I'm Dr. Deepa Daniel, a Melbourne-based GP and medical educator. Most of us know the risks caused by smoking, including heart disease, cancer and stroke. Smoking in pregnancy is also incredibly dangerous. There is no safe level of smoking in pregnancy. I'm going to be talking to you about the risks to you and your baby if you do smoke in pregnancy, and also why it's important for you and your partner to quit now, both for your sake and for the sake of your baby.
I found out I was 5 weeks pregnant. I cried to the doctor. I was very emotional because I knew I was smoking, and I told the doctor, how is this going to affect my child?
For a mother, smoking actually increases your risks of complications during the pregnancy. These include ectopic pregnancy, where the pregnancy actually occurs outside of the uterus, and that's quite a dangerous situation. It also increases your risk of miscarriage as well as premature birth. Cigarette smoking actually deprives the baby of essential nutrients as well as oxygen, which it normally gets from the mother's blood. Because of this, the smoking itself can actually cause the baby to get stressed during the birth process and can lead to more complicated deliveries. It can also cause birth deformities, as well as causing the baby to have a low birth weight, which is actually quite a serious concern. So having a low birth weight baby is certainly not something that any of us should aim for. A low birth weight baby is more stressed during the pregnancy and the labour process. They tend to have more breathing difficulties and need a lot more medical support after the delivery itself. They also tend to be more prone to infections, and so they're a lot more vulnerable than other babies. So there's absolutely no evidence that there's any stress to the baby if you do quit smoking during pregnancy. There is no safe level of smoking in pregnancy, and so if you're going to quit, it's best to quit completely. Quitting smoking is a challenge, and it's certainly something that sometimes requires a few attempts in order to succeed in the long term. But now's a really good time to quit. It's a really positive thing that you can do for the health of your family, your own health as well as the health of your babies. There's a lot of support out there for quitting smoking, and it's really important that you do get all the help that you need. There's no need for you to go this alone. In terms of the support, the first step is often to speak to your local doctor or your midwife so that they can tailor a plan for quitting that is right for you and your individual needs. Now's a great time to quit.
Hiya! My name's Crystal, and I used to smoke about 5 cigarettes a day, and then on the weekends I'd probably smoke about 20 cigarettes depending if there was like a special occasion. And so when I was 19, I went to the doctors and I found out I was 5 weeks pregnant. At the start I was a bit upset at the fact that I knew that I had been smoking the weekend just gone. As soon as I walked out the doctors, I did not smoke. I was very conscious and constantly thinking of the development of Jamie because I was so young, and it was very scary, and I just wanted to make sure that I had a healthy child. It was hard because I knew that being so young, all my friends were still going out and going to parties and stuff, and I went to one of my friend's 21st birthdays, and everyone was smoking, and usually I would smoke because it was, but I was constantly thinking, no, it's wrong, I have to stop smoking, this is, my child's life, I have to give up. A few friends have told me that, it should be fine, and when I was at the 21st birthday, they said, just 1 or 2 smokes, wouldn't harm. I just kept thinking, I don't want to be held responsible if Jamie, did happen to have asthma or, if any other health problems. I didn't want to be held responsible, thinking in the back of my head that, I smoked in this pregnancy, I could have, caused this. Since I've had Jamie, I've been a non-smoker. I don't plan on smoking. I feel happy and healthy, and I have enjoyed watching Jamie grow up healthy and happy also, and it's been the best decision I've made.
For more information, call the Quit line on 137848 or visit www.quitnow.gov.au.